So a lot of the work that I'd done in the laboratory during my training years involved immunology, and I sort of saw cardiothoracic surgery as the opportunity to be engaged in all of these other aspects as well, but also to be engaged in immunology and lung transplant in particular. So it was really a very nice fit, after I became engaged in training and stuff, there were even other things that came out, in particular the day-to-day things that we do that really impact people's lives, and that's very rewarding on a day-to-day basis. I do everything from elective heart surgery, so patients who would come in for an elective operation for a valve problem or a coronary artery problem or some other problem. Many of those patients are otherwise pretty healthy. They may be in the hospital only. I perform their surgery. They may be in the hospital for only 4 or 5 days, go home. I may see them once after that, and that might be the extent of my relationship with that particular patient. But then I also have this other side of what I do, which involves patients who have had progressive decline in their lung function over a period of time, or even their heart. Before I came to the clinic, I was actually also running a heart transplant program as well. So these patients typically, most of the time, their end organ function deteriorates over many years, and they come in quite ill. We usually spend some period of weeks or months trying to get a transplant for them. And then it usually takes a while for them to get better. And typically I see those patients even after their transplant, after they're discharged for a long time. By the nature of what we do in cardiothoracic surgery, I mean, all patients have, typically a very advanced form of disease that's usually life-threatening. They're always scared, their families are always scared. I think a big part of what I love to do is not only the technical aspects of things, but also helping them and the patient and their family get through that whole process. It's terrifying for most people, and they have a really difficult time with it. There are things that we do on an everyday basis, 3 or 4 operations a day, but for them it's a once-in-a-lifetime experience and a very real and life-threatening event for them. So I try very hard to make them feel comfortable. I try very hard to instill in them the confidence that we have as a team of people here that deal with these types of situations, and our ability to get them through it and to help them feel better. Well, I've a family, a wife who I love very much, and 4 children who are all still relatively young, but we spend a lot of time together doing a lot of family things. Kids are very active in sports and academically, so a lot of my life outside of work is centered around family events and things.